Good morning or afternoon, evening, everyone, depending on where you're logging in from. I'm Catherine Thompson. I am head of ecosystems for Cyber Future Foundation, and very excited about this panel discussion today. As many of you might know from the CFF world, healthcare and the security of healthcare has always been paramount in the forefront of a lot of our leader discussions. Back in 2021, we hosted a half-day session with the World Health Organization, looking at the current state of cybersecurity. And I think everybody can agree at that point, the healthcare industry globally was facing unprecedented challenges, not only in dealing with a global pandemic, but also dealing with the reality that the industry had become a very, I guess, popular target for cyber criminals. Back in the summer, we decided to revisit the topic and look at what was happening in the industry. So we hosted 3 town halls looking at healthcare cybersecurity from different vantage points. We looked at it from innovation acceleration in terms of what these advancements were doing in terms of the quality and delivery of care, and also some of the challenges they were creating for security leaders in securing that technology. We also looked at it from a policy and government legislation perspective, everything from the protection of data and privacy to the increasing calls from government organizations for a more mindful approach to secure innovation, so that secure by design concept. We also looked at it from the daily realities of what healthcare security leaders were facing. Many of them are very similar to what other security leaders are facing. Decreasing budgets, finding and retaining quality talent. But for the healthcare cybersecurity leader, there was also the reality of dealing with conflict, not just the conflict that was faced during the global pandemic, but as many of you know, and Kirill is one who can relate to this, trying to manage and secure infrastructure during a time of active warfare. So in this session, because one of the recurring themes across those 3 town halls was the calls for increased and ongoing collaboration across sectors, whether it was government, academia, the cybersecurity industry itself. A lot of our industry leaders were saying, if there's something we can do, what is it? How can we support the healthcare cybersecurity sector better? So in this session, I've called upon 3 leaders with very interesting vantage points and opinions and expertise as it relates to this topic. And I wanted, before we dig into this, for everyone to maybe give our listeners a little bit of background on your expertise and some of the things that you're seeing. So Norma, I'm going to kick it off with you. For those of you who don't know Norma's incredibly respected and well-known in the industry. Norma Cram is the Vice President and Chair of the Cybersecurity, Privacy, and Digital Innovation Practice with Vince Coik and Associates. So Norma, I'm going to let you kick it off.
Sure. Thank you so much for that, Catherine. It's great to be here with the team and with CFF focusing on yet another really mission critical issue. And one of the things I think that's important just as we think about these issues together, when I think about cybersecurity issues, I come at these from that national security, homeland security perspective. And having worked in the U.S. government at the U.S. Department of State, Commerce, FEMA, and a few other agencies, it's from a global perspective, right? Where do each of these sectors fit when we look at whether it's geopolitical conflict or just basic cybersecurity risks? And having created a cybersecurity practice actually in 2005, so having worked now for over 15 years full time, I focus on how critical infrastructure, health, as one of our mission critical and lifeline sectors, is impacted by cybersecurity issues and tech issues. I know we're going to talk a little bit about AI as well, but it's how does cyber fit in these heavily regulated industries and what is the outlook? And I'll tell you, when I started looking at health issues in 2000, I'd say probably 2005 and 6, it was really interesting to me because the industry initially, whether it was hospitals or medical devices, thought that they were perfectly secure. And that's because they've been regulated for the privacy components, right? Safety components for so long. And what I have learned, and we see across all sectors, is there's a culture in how different industries understand and manage risk. And I think for health, there was that challenge of privacy and safety had always been paramount, and that automatically meant cybersecurity. Now, we learned, unfortunately, that that is not the case. And I'm going to just spend 2 minutes on a particular aspect, which is medical devices. When you think about medical devices and implantable medical devices, right, that was always mission critical for safety issues. But as far back as in 2011, we saw a researcher actually hack into his own insulin pump. And it was in 2014 we saw the major public disclosures of cybersecurity attacks on medical devices from Medtronic, Boston Scientific, and St. Jude's. Fast forward, and we'll spend a little bit more time on this later, what we have now seen is the industry having come together to come up with voluntary best practices is now that there are mandatory requirements for cybersecurity for medical devices. And ultimately, I think, all sectors are seeing those mandates, some of which could be helpful. But what we want when we see whether it's regulations in the US or around the world is that they are outcome focused, right? It should not be prescriptive. And so I know we'll talk a little bit more about that. So Catherine, back to you.
And I do want to dig into the medical device discussion a little more in this session, because that was one that was brought up in terms of bringing that part of the industry to the proverbial table, and some of the challenges there. Errol Weiss, Chief Security Officer with Health ISAC. When Denise Anderson, your counterpart and boss, was on the panel when we kicked off day one, she made one of the comments she made was that the Hollywood Presbyterian hack that took place back in 2016 seemed to be the tipping point, in which unfortunately cyber criminals started to realize the lucrative side of targeting the healthcare sector. What are some of the other things, because your membership is very broad and global, what are some of the things that you're seeing and your members are talking about right now?
Well, just thinking about it at the broad level, what I'll start out with is 3,604. And that's the number of personal health records that will be breached in the hour that we're having this global forum. When you look at the number of PHI records that have been reported to HHS and the OCR, we affectionately call it the wall of shame. There's 438 million patient records that are listed there over the last 14 and a half years. So do the math and we get to 3,604. And to me, that's only an indicator of one of the indicators of the state of cybersecurity in healthcare. And I have to agree 100% with Norma about the focus in the past has been on privacy and safety, but not necessarily security. And I think we need to do better. We need to change that focus. The next thing I'd also talk about, Catherine, you asked about some of the threats. Well, ransomware is certainly one of the big ones that we worry about. You mentioned the case of that hospital. It's certainly an issue that's very much on the top of minds of cybersecurity professionals in the sector. When we conduct surveys, and we're going through one right now for our next annual threat report with Health ISAC, ransomware is usually number one or number two on top of mind in terms of what threats those organizations are worried about. And interestingly enough, I'll say that over the last 3 years, Health ISAC has tracked over 12,000 ransomware incidents that have impacted organizations across all of the sectors, not just healthcare. Now, the interesting thing is that the healthcare incidents only account for about 5% of those cases. Now, if you were to only pay attention to the media and all the reporting that's out there, you would think that almost 100% of the ransomware incidents were impacting hospitals. Well, that's just not the case. Every single business and every single sector is getting attacked. And it's making the news, and it obviously is impactful for healthcare because we see major disruptions happening in this space. Hospitals having to divert ambulances to other locations, delaying patient care, canceling appointments, lab results getting delayed, and appointments again being canceled or rescheduled. So there's very much a human impact to it that we all feel personally, and none of us ever want to see anything like that happen. But again, it's I think it's a result of the lack of resources, the underfunding that we see in healthcare, cybersecurity spending. The bigger issue, though, is what can we do about ransomware? I think that we need more help. We need to punish the bad guys who are behind this. We need to spend more resources. We need government to take a larger role in stopping ransomware, potentially preventing the ransomware payments from even happening in the first place, but really taking a more active and proactive role there. So I think I'll leave my opening remarks for that and turn it back to you, Catherine.
So I guess we're going to need a little bit more than the hashtag stop paying ransomware to fix the problem.
Yeah, unfortunately.
Kirill Gonchark, you participated in the discussions in the town hall session, and you're kind of in a unique position in terms of not only being an entrepreneur and founder of Checkeye, which is a Ukraine-based healthcare innovation company, but you're also a security leader. So you've got kind of an interesting vantage point. What are some of the things that you're seeing, especially as it relates to what's happening for the healthcare industry in the Ukraine right now?
Yeah, thank you, Catherine. And this is really interesting what we see here in Ukraine. That's we, as Guy says, it's a lot of focus in the North America now on the ransomware, and it's a huge trend on attacks. But what we see here in Ukraine, that ransomware is a step, make a little bit step back, and due to the current war, there are more and more threats are based on the hybrid attacks. And when a lot of cybersecurity threats leads to the impact on the physical world and on the physical impact and vice versa. So, and in this kind of, let's say, hybrid war, we see that impact of attacks based on the social engineering, on the stolen credentials, are take a leading roles in our environment. And if let's say 3-5 years ago the ransomware was one of the biggest trend, that's now we see that it's less used on the such environment when hackers and Russians start to combine different attacks, and they try to make more influence on the physical world. And this I think this trend, especially when we moving in healthcare from the not only health records, it's very painful when we lose them, but when we move to the intensive care, to the systems which have influence on the care of the life critical for the patients, it's can lead to the totally different threats and totally different focus. And as the healthcare is just starting as the industry journey in the cybersecurity world, in the implementation of new technologies deeply in the processes, it will be the biggest trend in the next few years, as I think. And what we see here, that the numbers of attack increase 10 times for the last 2 years. And for example, as you said, from my background as responsible for the last 6 years on the one part of the critical infrastructure from the cybersecurity, we see that we face it more than 100,000 attacks per month for the just on the telco infrastructure. So it's huge numbers of attack. Yeah, thank you.
So, and again, there's going to be a lot to dig into in this discussion. One of the areas of innovation that was discussed during the town hall sessions was AI. And, I think while security leaders in healthcare saw the enormous potential for it, there was also some concern. We saw the White House come out with the AI directive a couple of weeks ago with the intent of, AI that was secure, safe, and would develop a threshold of trust. From an impact perspective, and I want to look at this both positively and negatively, I don't think we should always focus on the negative side of things. What kind of impact will this directive have on innovation, on legislation, and on the advancement of security and cybersecurity within or as a part of AI? And when we met as, panel prep before this, I found it really interesting how you folks kind of got into discussing that topic. So I'm going to kind of tap Norman to lead this off in terms of where do you see the opportunity and what kind of collaboration is going to be needed to make sure that this directive and the goals are met.
Sure. I'm really glad we're talking about this issue, because when we think about just health in general, the health sector, whether it's hospitals or medical devices or really that broader health ecosystem, we've always seen that innovation, right? Technology has always been on the leading edge in the healthcare industry. And in fact, the FDA and certainly in the medical device community, they have been far ahead on things like machine learning and AI. The FDA, in fact, I think it was in 2019, started talking about what a regulatory framework should look like, particularly when we're talking about AI and medical devices. But Catherine, to your point, the White House did issue a very comprehensive executive order on artificial intelligence just about 2 weeks ago. That covers every aspect of health, and it actually, it does a couple of important things. Now, when I think about tech in general, or just AI, I always like to say it's about risks and opportunities. When we first started looking at cybersecurity, we said, for goodness sake, let's not connect everything until we know what those risks are, right? Now, that boat sailed and we're dealing with those challenges. What we're doing right now in AI, and what I hope the executive order does for everyone across all critical infrastructure, is to give people a strategic pause. Because as the White House AI executive order talks about, the term they use is the promise and the peril. Right? Let's, again, not rush into, tech everywhere, AI everywhere, if we don't know what it means. Now, particularly for health, there are some major directives that I think are important. First, Health and Human Services has its own mandates, and obviously FDA is part of that community. They have to create an AI task force. The goal is to look more broadly across the health industry to see where AI is being used. And the focus, of course, is to look at and create a strategy that would help protect safety and security. That's very important. Now, obviously, that's kind of a precursor, potentially more regulation. The other thing that this does is sort of marry the work of the Department of Homeland Security with HHS and FDA. So the Department of Homeland Security with our cybersecurity agency has to work with all these agencies, and their job is actually to create an AI risk management framework per sector. Now, kind of in that carrot and the stick, we'll talk about that in a few minutes, right? The goal is for industry to work collaboratively with the administration, but the executive order does direct our Office of Management and Budget. And for those of you who are not US based, that's sort of what we call the mom and the dad when it comes to mandating things across the federal government, to actually look at implementing regulations in general. The other thing it does for the Department of Homeland Security is it says it must assess the AI risks by sector. And when we look at AI, particularly for this executive order, again, the goal is opportunities and risks. In the cases where artificial intelligence and actually quantum are going to be used by nation states against us, it actually creates more cyber vulnerabilities for us. So I'm going to pause there, because AI is a behemoth in and of itself, but that AI implication for cyber vulnerabilities in health is also a very large issue. And I know my colleagues on the panel will have some views on that too.
So, and this is great insight. And part of the AI directive touched upon that innovation and the use of AI and innovation. And Carol, this is something, because Czech High is very much, the technology is very much immersed in an AI capability. From your perspective, and I know the directive doesn't necessarily impact your country, but I'm sure, like other countries, you're taking a look at what this means. How important was the security of the innovation in terms of the development of Czech Eye?
Yeah, we are totally AI-based solution. So for us, it's like an mantra, and we are living around this. And from one side, it's great because definitely AI in healthcare should be regulated, and we should to understand all not only positive influence which this bring to our life, but negative. I'm totally agree with Norma, because it's like with the nuclear power, we have very positive in our life impact of the nuclear, but we can have a totally different and opposite impact from the other side. And in Europe, in European Union, the new regulation was introduced 5 years ago, and now from the 23rd, we need to go. Every medical device which are introducing on the market should be related or in line with the new regulation, and we have 5 years from now for any devices which was introduced last before to be in line or recertified with the new regulation. But it's bring a lot of great insights for the software devices, because due to the new regulation, it's cybersecurity and information security should be implemented from the very beginning, from the very start of development in the full cycle, as it was implemented on the others industry. I don't know, from the SOX implementation a lot of years ago, and now you should to be from the operational point of view, from the development point of view, and from the all concept point of view, you should to be in line with the cybersecurity statement and cybersecurity spirit in the inside. So this is a huge value which we are gain from the regulation, and when we start implementation, it's on the market in our products in general as the industry. And it's bring, if we start to do it from the very beginning, from the very first step of development, it will bring more safe products on the market in near future.
So Errol, from the Health ISAC perspective and your members, like I said, I think it was Paul Connolly that called out the potential for AI, but also some of the concerns that it creates for leaders like himself. How do you think this directive will be received within your community, and what are some of the things that you would like to see in terms of a collaboration across the sectors?
Yeah, it's great, and like like we've already said, the cat's out of the bag, so the horse is already running down the track, and now we've got to kind of back up and see what we need to do to better control things. But I love the way Norma put it. I'm going to steal that line about the promise and the peril. So on the promise side, we are already seeing really exciting and incredible innovation with the uses of AI in healthcare. Things like better imaging results, improved diagnostics, earlier detection of cancer, kidney disease, more effective treatment plans for complex diseases, robotics that are used to improve surgery, even remote surgery, right? So the surgeon's not even, they could be half a world away from you and conducting that surgery. So I think like the best care anywhere. And then the one I love about improving patient engagement, getting patients more involved in their healthcare through the use of AI, and they ultimately end up achieving better results. So, and as we've seen, right, there's definitely some security risks here. So, just to highlight some of those, top of mind is loss of data. So anytime you put anything into ChatGPT or Google Bard or any of the other AI tools online, like any of these websites or any sites that you visit, you are giving that data away. And now we've got an intellectual property issue there. There could be a data leakage problem as well, and a data retention issue on top of that. There's a famous comedian, Sarah Silverman, is currently suing ChatGPT for theft of intellectual property in terms of her books being used to teach the model. And so now she's in litigation with them, and we'll see how that turns out. Trust and integrity. Can you trust what comes out of the model? We've heard about things like AI hallucination, the provenance, the accuracy of the data, the models that have been used to teach the model. What can we rely on the data that's in there? And then, of course, we get the intentional adversarial use. So we know that the bad guys are already using this kind of technology to perfect spam emails and scams that they use to perpetrate online fraud. Now we're reading about voice cloning and other interactive conversations that the bad guys are using AI technology in order to further perpetrate the fraud. So a lot of great uses, but a lot of caution there as well. I think that the AI executive order will highlight some of the things that we're already seeing use in place in some of the hospitals and health providers that I deal with today. When they look at things like implementation of this technology, they want to make sure it's safe for humans, that there's level of transparency, that we understand the inherent models that are underneath, that we eliminate bias in those models, and ultimately we make sure that there is a human being in control of the delivery of the healthcare.
So one of the questions that I have based on some of the commentary here, and it kind of backpedals back to what we discussed in the summertime, was in terms of the collaboration piece, bringing those, if you can get government to the table, you can get the innovation sector to the table, you can get academia, and but people did, and I'm going to kind of point this a little bit at Norma. One of the sectors that did get called out for being reluctant to come to the table were medical mobile device manufacturers. It was hard to get them to the table to disclose, to have those open conversations. Is that something you're seeing, or is there other sectors that maybe won't be as receptive to the whole idea of coming to the table and opening up the kimono, so to speak?
That's a really interesting question. And I'll say, let me start with medical devices and I'll go into other sectors. Again, I go back to these culture issues. I think there was a culture in the medical device community because they were building things to specific regulations that the FDA had for safety issues that automatically covered cybersecurity. Right. And then the data security protection, everyone sort of said, well, that's a no-brainer. I've had to do that for years. What we started to see, though, is that the medical device community honestly, because there were public cybersecurity attacks that forced the regulators and kind of forced everybody to come together, that I think they have acknowledged the cyber risk. They now disclose it through the Department of Homeland Security and CISA. And then they, share information about how to manage and mitigate vulnerabilities, right? That's what we want. But what we also want, I think, more broadly is for any industry, and particularly in health, where we have so many issues that we're concerned about, right? Ultimately, we're concerned about not just that data protection, we're talking about patient health and safety, and actually potentially fatalities or injuries if we don't have access to medical records, or surgery can't be performed, or there's a problem with an implantable medical device. And that is even looking at the basics. And where the industry came together with the FDA is to look at things like what we call the software bill of materials. That means you actually have to know exactly what's in your systems, software related to hardware. And then we're having a much larger conversation around the world, not just here in the US, about the use of open source software, right? So what we have right now is the medical device industry and hospitals, and actually every critical infrastructure sector, who are having this layered approach where they use open source software and then they build things. The other thing the White House has been very clear on with its national cybersecurity strategy that was issued some time ago, but they're working with nations around the world about this, is who has that responsibility? And so whether you are health or any other sector, if you're using open source software and building it into another software or hardware device, then you own that liability. So again, the point is more awareness together about where that cyber risk comes from. What does it mean, when you're putting out devices or new products? And the last thing I'm going to say that is not systemic to the health industry, but it's across critical infrastructure, is we need to, as best we can, stop that first to market mentality, right? Yeah. The goal of just putting out the, what is considered the best, smartest, sexiest product to market first. If it's not secure, don't do it.
Yep. And you saw that with when earlier this year when CISA came out with their whole Secure by Design campaign. And I know it was targeting software developers, but as you said, there's a mantra in the software industry that says speed to market is speed to revenue. And especially if you're in a situation where you have venture capital involved in that, getting that technology to the market, there's that pressure. But Kirill, a question for you in terms of Checkeye, because I know, in our discussions that and you talked about this, there was a mindful approach to security when you were developing the product, when you were developing the technology with Checkeye. So, I always like to say it's good to have one side of the desk that talks about how the technology can be used, and the other side of the desk that talks about all the ways the technology could be misused. Is security a selling feature for you, or the mindful approach to security when you're talking to potential customers and users? Are you folks talking about with the security mindfulness that was put in the development of Checkeye?
Yes, I'm totally agree with what we discussed previously. That we are all using an open source software in our solution, especially when you use an AI model, you use machine learning models, you use a lot of different open source models or other models, and then you need to understand which it lead to your end product and how it's influence your end product. And for sure, when you start in developing, you are, and from the cybersecurity perspective, you need to bring it from the whole design of the product. That's it will be protected and protect of the data, protect of the in our particular case for the images, because they can be part of the personal and medical data of the customer and so on. But when you come to the, let's say, end users or our customers as a B2B who will use our product, in general, maturity of the healthcare now, they are mostly thinking about the digital transformation approach, not about the cybersecurity. Cybersecurity they will focus in a few years later, when they understand that when they start transform their process in the totally new digital approach with the disruptive technologies, they will face problems in the 2, 3, 5 years ahead, which are related with the cybersecurity. And if they are not implemented it from the very beginning, from the very base statement of the transformation, the problem will be huge, and they need to invest in this in the future a lot of money to just address this problem, which they don't understand. And it's not a point of sale for them definitely now, but when you come to the healthcare professionals and sell them digital transformation, you need to touch this point, and you need to educate them. That's guys, you need to think a 2 step ahead, 3 step ahead, because it will be a huge problem for you if you don't start to think about it. But for sure, it's hard to speak when people are doing very first step on the digital transformation about problem which they don't understand now, even not understand now.
Errol, your thoughts? Because that's a lot of what Kirill's saying. I see you nodding your head.
Yeah, I was just thinking again about the question in terms of like what can we do to develop those trust relationships and establish that level of collaboration. So, having done and been involved with various information sharing groups over the last, I'll say 20 years of my career, the thing that I've found is it's like any kind of a relationship. You have to invest work to develop that trust. And once you have that trust, people are more willing to share. Especially when it comes to incidents that they may be dealing with, challenges that they may be dealing with where they need some help, and to be able to provide that information for the broader community so that they can use that information to better protect their own environment, learn from those mistakes maybe, or those lessons learned, and help improve the security resilience of their own particular networks and environments. And so, I would point to like some of the work that's being done in the U.S. with the Health Sector Coordinating Council. We've got representatives from government, HHS, CISA, DHS, and many more meeting on a regular basis, several times a month with private sector representatives. We also meet twice a year in person. I mean, just, those are just the kinds of things that you need to do to keep that relationship alive, develop those interpersonal networks and those relationships so that when things do happen, when you need somebody, you need some help, you need to be able to share something, you've got that trust built. And I'll just point to, like, over the last, this past month, for example, Health ISAC, we conducted an exercise in Washington, D.C. called the Hobby Exercise. We have representatives there from HHS, FDA, FBI, and CISA, plus about 24 folks from the private sector as well, working together on a tabletop exercise. And then myself, I've got I'm attending a meeting tomorrow at the local FBI headquarters. Again, just to continue the relationship and work with folks so that we have those relationships. The point is, you can't just sit around and expect things to happen. You've got to work it. You've got to put some energy into it.
Apologies for that. My kid wants to call me. These are all, and I guess I open up to the group here a bit, this discussion, this point, because these are all really important. Here's the question. If you look across directives like the AI directive, and we saw this with the national, and again, Normie, you referenced the national cybersecurity strategy that the Biden administration put out. They're pretty broad. They're aggressive. They're definitely needed. Nobody is arguing that point. But in terms of, let's take ransomware. There was, after the Colonial Pipeline, there was a very big uptick in discussion around, we need to make sure that ransomware isn't paid. And I agree with that. But in certain cases, there is their element, and healthcare is one industry, that sometimes it's a matter of life and death. Is there specific, in your mind, is these blanket types of initiatives need exceptions, or do we need to consider the specific life and death aspects that sometimes come into play in the healthcare sector when we're making these legislations? And how can we better support the sector? I know this is kind of a question coming out of the blue, but you folks are taking the conversation in a really interesting direction.
The issue around ransomware to pay or not pay is a very, interesting and important one. At the moment, if critical infrastructure like health is owned and operated by the private sector or even public entities, and they are responsible for managing their own cybersecurity risks, it sets up two important questions. It certainly, from a high-level policy perspective, makes sense to say, don't pay the ransom, because if you don't pay the ransom, right, you're sending a message to the attacker that they're not going to get anything, and theoretically they'll all go away. Ultimately, no, Norma's opinion only, I don't see that as being the panacea unless there are going to be more tools and solutions for every entity who's managing a ransomware attack. Now, this is a circular problem. Entities who are not, whether they have the best or maybe the worst cybersecurity protections, can still fall victim to ransomware attacks. And depending on where we are in general, in the case of health, it could be life or death. So I think blanket statements that ransomware payments should not be made is something I really would encourage policymakers around the world to have a more focused discussion about, because it's just not, you can't just say that and walk away. The second thing I think that is really important when we think about these issues, at least in the United States, about a year and a half ago, Congress did pass a new law, and that does require a formal rulemaking process, little gobbledygook for those who are not US-based, that will mandate that certain parts of critical infrastructure report both cybersecurity attacks, but also will require them to report ransomware payments within 24 hours of making the payment. So at least in the United States, there's this push and pull about how do you manage ransomware attacks, right? How do you reconstitute what I'm going to call lifeline sectors, of which health is one. And certainly the U.S. has been leading, actually it's a 27-nation effort, Countering Ransomware Initiative, or CRI, in order to get kind of allied nations around the world to come together to help try and address the ransomware issue. But I will say this, ransomware is lucrative by attackers, right? And when we talk about why attackers are coming after certain sectors, it's to steal, disrupt, or destroy. And the stealing part is very, very easy right now, unfortunately. Over to you.
And Errol, because as I mentioned, Janice, when she kind of pointed out the Hollywood Presbyterian hack in 2016, and the payment, which was Bitcoin, but the payment that was made, what is it? I have to believe that within your organization and your membership, the whole topic of ransomware probably has some very strong opinions. Is that the case?
I mean, I think Norma summed it up really well. It ultimately does come down to a business decision. I just, when I was in the banking and finance sector 10 years ago and ransomware started, the bad guys were attacking just individuals like you and me, and they were going after our home computers and scrambling our photos. And, of course, if I lost all my history of photos, I'd probably cry and be pretty upset, and maybe I'd pay a ransom. So, but we saw in those beginning stages that hey, this is starting to turn into a business, and this is going to catch on. And much to Norma's point, unfortunately, it has. And now we see what the ransom payments amounts that we see today are just staggering, multi-million-dollar payments. And why? Because ultimately it does come down to a business decision. If they cannot operate and they cannot restore from backup, then there's going to have to be a decision about whether they pay a ransom or not. And ultimately, whether it could be a life-saving situation. And I know if I was in that situation, needing healthcare and looking at a ransomware payment, I would hope that someone would make that decision, that right decision. So, back in the beginning, when I talked about like what can we do from maybe a government intervention standpoint, I think the thing that government should be doing globally is regulating cryptocurrency. And I know that might be a hot button topic, but because it is the Wild West out there and the bad guys can move money around with complete anonymity, we need some regulation so that we can make it harder for them to cash out and obtain real currency through these kinds of actions. One other point that I would make too, which I thought is really interesting, is on the other side of this coin is, how can we improve security at the healthcare provider side of it? And I know we mentioned at the beginning here too, where there's been a lot of discussion about sort of setting a minimum cybersecurity hygiene standards across the board. The thing that is always lacking is, how do we do that? We need the resources to be able to do that. And I thought, something really interesting and promising is literally 2 days ago on Monday, we saw that the New York State governor just announced new regulations and funding that's aimed to improve cyber resilience of healthcare organizations in New York State. And the regulations are meant to do things like requiring healthcare organizations to designate a CISO, develop security plans, implement an incident response plan. But there's also some meat to this. They're putting $500 million in funding behind us, which I think is really exciting, and hope to see what happens and what other activity is spawned next as a result of this.
So, and this is I saw some of the comments that came out on social media around that announcement from the New York State. So it was great to see that kind of support and uptake on that. In terms of ransomware, especially in times of conflict, what are some of the things that you're seeing and hearing and also experiencing, Carol, in terms of the impact in the Ukraine during this conflict?
It's a really interesting trend because if you remember 5 years ago, we have a huge ransomware attack on Ukraine infrastructure when it's more than 80% of businesses was disrupted due to the attack of NotPetya, which was encrypted I think each particular business in Ukraine. And but what we see, it's I think two interesting outcome from this. In few years, most part of businesses forgot about it, and a lot of businesses just say that okay, it was one time, we are survived, and let's forget about it. Do not put a lot of attention on this. And this is a position for the many businesses in the country. And from the other side, as I said in the very beginning of our conversation, we see that during the conflict, numbers of ransomware decreased dramatically. So the hackers are switched to the other angle of attacks, other trends, and the numbers of ransomware. It's a lot, especially based on the social engineering, and especially based on the some regulation or other things which are used in the deployment of the ransomware inside the business networks. But the percentage of ransomware attack, I think it's less than 10% of all threats which we are facing. So this is a two different way. And when you say that pay or not pay is a business decision, yeah, definitely it's a business decision. But the next business decision, it's how we should to protect our infrastructure for the further such attacks. And a lot of businesses decide to do nothing. And that's why I think that the role of the government or regulators should be, yeah, as Errol said, that's to make this base level of cyber hygiene and to move all sectors slightly through this basement higher and higher and higher.
So I've got a couple of questions that come in from audience. First one question I have is, do you believe that an independent legislative body to assess the security of technologies is needed to ensure that the healthcare industry has the level of security going forward?
No. So let me, yeah, it's kind of a violent reaction there. Yeah, I'll just start off with a big no on that. I mean, I think the issue is that unless the government regulators are prepared to fund that and help the industry achieve that level of security, then I think it's tough for them to require it. I think, and the other part of it too is I think the industry itself is better prepared to help create a set of voluntary standards that, or at least set the baseline standards that organizations should achieve, and we have a better opportunity to act more nimbly, so to react to new threats and new issues as they come up. If we legislate it, it's going to be behind the times. It's going to be too late, I think, and not be able to react quickly enough.
Norm, any thoughts on that question?
You know, I agree with that. Look, we have a regulatory structure in place right now with the Department of Health and Human Services, the Food and Drug Administration, the Department of Homeland Security, and CISA. And I think what would be more prudent is for these agencies to work more closely together to talk about the types and changes in systemic cybersecurity risks with owners and operators, right? Those are public and private in the health sector, to help them understand the risk. If there are to be regulations, which, you know, already exist, and honestly, there will be more, that I think that is just the reality, they should be outcome focused, right? Let's have HHS particularly, or FDA, define what the outcome is for what everyone must be required to meet, because we're still talking about very basic health, safety, and security. At the end of the day, you know, I have seen other regulators in other sectors sort of pose the idea that they would require owners and operators to show them the code in their products. And as I said behind the scenes, tell me why you think you would be able to find the problems more quickly than an entity that you're regulating. So I think there's a balance. Should it be a wild, wild west where anyone can do what they want in health, particularly? No. But, you know, creating yet another body that will take, as Errol said, He didn't say forever, but I will. That's just not as nimble enough to manage what the risks are. But let's make sure the people who are in charge of these issues are managing it.
That's a great point. Carol, any thoughts on this one?
I'm not think that I'm totally agree with what guys said previously, because I think that to have let's say non-profit body who can be, let's say, center of expertise or center of authority for the whole sector, it's making a public-private dialogue easier. Because to build this dialogue, you need somebody who will aggregate all, let's say, knowledge and be the standard placer on the game. So I think that such approach can bring a lot of value on this public-private dialogue in the industry.
I just want to add one piece. I agree with that. I think at least in the United States, we do have different structures that are public-private, voluntary mechanisms. We have centers of excellence with the Commerce Department, the National Institute of Standards and Technology. So I think those exist. The question was an interesting one because it's sort of mixed, at least in how the U.S. kind of legal system works. And it was whether or not, should there be should there be legislation that mandates the creation of something new, right? So there's a little bit of everything in there. But I agree that public-private partnership is really important. Best practices, and sharing is critical.
Yeah, totally agree.
So I've got a good question here from Jamie. Jamie asks, how can industry and government better support rural hospitals and their security needs? Because we need it. Anyone want to tackle that one?
Well, I just would extend, what I mentioned about that New York initiative. I mean, I hope that something like that catches on and we see more things like that happening across the rest of the U.S. and globally for that matter, where we have government pitching in, trying to help out. One of the things that I thought was really interesting in that, in the language in that was about identifying a CISO. And I thought it was really interesting, coming from the healthcare, coming from the finance sector originally to this job. And I was talking with a CISO at a large U.S. hospital system, regional hospital system. And that person mentioned to me that they were the first CISO that they have ever had. And they were only there for like 6 months. And I was thinking, how could that be? In finance sector, you had to have a CISO. So I think it's a good trend. It's a move in the right direction, and let's hopefully see more of that.
Any other thoughts from panelists on that one? I know that was, that's a recurring theme that we hear in our discussions within CFF, which is, if you're in a large urban center, the access to skilled talent and the labor pool, the access to increase funds and budget. But if you go outside, and we see it quite a bit up here in Canada, you can get, if you're a sick kids hospital in downtown Toronto, you have a full SOC and a CISO. You drive literally an hour and a half outside of Toronto, and they're very lucky if they have somebody in IT who, does anything more than actually having McAfee. So any thoughts on that? I guess, Carol, from a Ukraine perspective, is that a reality that, rural areas maybe struggle a little more than if you're in a large urban center?
Yeah, for sure. Urban area is, let's say, easier for access in general in healthcare and easier to access to the information security, IT services, and usually it's a little bit more matured on the understanding and adopting these technologies in their day-to-day life. And for sure, in the rural area, a lot of problems in using new technologies and from different points of way, from the lack of professionals, from the lack of budgets in the end of the day, because the profitability usually is at least here in Ukraine, usually lower in the rural areas than in the urban areas. So for sure, it's bring us to the, maybe in ideal world we should have some let's say clinic as a service, which should cover based needs of the such hospitals, and can be provided by, for example, it's a good example of the New York State's initiative, and it's can be provided on development on the, let's say, state or other authority level, to provide for the hospitals as let's say as a service or as a basement for them to build all other their day-to-day operation.
So we're getting almost to the point to wrap this up. So I wanted to maybe start with Norma. Any kind of final thoughts, wish list, anything around how do we ensure that security and trust in some of these collaborative opportunities are at the forefront? How do we make partnerships work so that they're productive?
Sure. First of all, thank you just for having this discussion. I really enjoyed it with my colleagues on here. And I think we've touched on so many issues. We'll have lots to talk about in the future as well. The first thing I would really say is, in order to even get to that place where people are at the table together, where we can even think about trust, is we really need everyone in the healthcare industry, and there's so many different components, to actually understand the risk. Right? We've talked about the fact that sometimes someone might have an incident, they address it, they move on, and it's as if it doesn't exist. I mean, in 2022, the FBI released a report that basically said, and this was just last year, 53% of digital medical devices and other internet-connected products in hospitals had known critical vulnerabilities. Critical, right? These are not just, things you can fix later. So first, everyone has to understand the risk and their shared responsibility. I think once you understand the risk, it's also easier to sit at the table with the US government, any government around the world, to talk about what the risks are, maybe what tools industry needs. I'm going to use the term owners and operators, because in the United States, we have public entities or nonprofits who also are part of the healthcare industry on top of for-profit. So understanding the risk, knowing that you have to manage it. The pieces that are in the New York requirement, the new rule, those are foundational. Those are the basics. Ultimately, what we're saying in general is we need everyone to raise the cost to the attacker. Make sure you have sufficient systems. Make it harder for them to do what they do. And the last thing I'm going to say is, I go back to, what do they want? They want to steal, disrupt, or destroy. And I think if you take that lens for yourself and go back and look at what services you're providing, where are you in the healthcare industry, that's real. And we don't want to scare anyone, but this is the new reality. And I think if people understand that, they're perfectly able to look internally and go, now I know where my gaps are. Here's what I need to do. And here's what I need help with. And ultimately, I think the US government and global governments want to help industry get where they need to go.
Excellent. Errol, your thoughts?
Yeah, I think, building on top of what Norma mentioned, I'd say that, get involved locally, regionally. There's lots of information sharing and security professional groups out there to support these kinds of things, to be able to share lessons learned, to be able to share information on threats and vulnerabilities and whatnot. It's not just the ISACs. If you are part of healthcare, you are part of a critical infrastructure, so you can certainly belong to something like Health ISAC, but there are other information sharing analysis organizations, country CERTs and country ISALs, for example, that you could belong to. Many of them are available for you locally, and many of the local law enforcement, federal law enforcement, international law enforcement organizations support the notion of information sharing groups as well between public and private sector. So, get involved. And I always say that you get so much more out of it than you put into it, but you have to participate.
Excellent. Kirill?
Yeah, I totally agree. But what I think is very valuable and very crucial now for the healthcare industry is it's all industry going through the digital transformation very quickly. So if other industry are spending years or decades to come where we now, healthcare is going very quickly, and in this quick transformation. They have a lot of information sharing from the other side. That's you need to focus on this. You need to focus on this thread, on that thread, and they usually can be easily lost on these numbers of threads, informations, sharing information, and so on. So I think that other industries and regulators can help generally for healthcare industry if they provide more solution from the shelf, and that will be easier integrated and more protected and easier to adopt. Because when you go, let's say, through the 3 years, what other industry go for the decade, it's easy to lost in all this threads, information, and so on. So we need to help them and all industry to navigate through all this all this noise and threads where they are now joining.
Folks, thank you so much for your time. I've got a couple of questions from viewers that we weren't able to get to. I will send those out to our panelists. Any of them want to respond to those questions. We will also have the video stream edited and available for folks if they would like a copy of it. Norma, Errol, Carol, thank you so much for your time and for your participation.
Thank you.
Thank you.
Yeah, thank you.